and good afternoon. Thank you for joining us. I'm Eileen Britt, and I'm the Regional Rehabilitation and Community Coordinator for the Central South Stroke Network. It is my pleasure, on behalf of my co-chair, Holly Arnold, and the organizing committee of Tina Valentin, Stefan Paliuzzo, McKenna Kaplan, Catherine Chappell, Barb Moore, Tatiana Dordovic, Maria Roth, and Sarah Skanes to welcome you to the 2025 Stroke Community Partners Roundtable. We are a group of over 80 people this afternoon, crossing the geographies of Central South Ontario and a little bit of the Ontario Northwest. As persons with lived experience, as care partners, and as stroke care providers, we hope you find this afternoon meaningful and informative. We know that our current economic situation is uncertain and strained. In addition, we know, as we've heard through our various conversations and exchanges across all of our communities, that many of you are living with stroke and that trying to make ends meet is becoming more and more challenging. For some, it is a decision to have one, but not the other. And sometimes it's to totally go without. This impacts your stroke recovery and quality of life. This is stressful. Not only is it the physical cost of being stressed about finances, but it is also the mental and social toll as well. Affordability, while trying to maintain your post-stroke recovery regimens of exercises and mobility, diet and nutrition, housing, eye care, dental care, transportation, etc., is stretched beyond measure. The costs of exercise programs, the cost of gas, the cost of parking, the cost of groceries, the cost of rent or mortgage payments, the cost of equipment or devices for your mobility and your ADLs, the cost of eyeglasses, the cost of adaptive clothing. It's all the costs. We know it adds up. We hope this afternoon's sessions with our invited panelists can present you with options and possible assistance to ease your financial worries. We've asked the speakers to share their programs, resources, and references so that you can gain knowledge about what's available to help yourselves, reduce your costs, and ideally lessen your financial stress. This afternoon, we present panelists from March of Dimes Canada, from Vision Loss Rehabilitation Canada, from Assistive Devices Authorizer, from Services Canada, and from the Canada Revenue Agency. After the first four panelists present, we will offer a question and answer period, which will then be followed by a break. We will resume for our final two presenters and conclude with a question and answer period encompassing their presentation. Our goal is to end on time, which is 4 o'clock. Some of the session today will be recorded and some of the slides will be posted on our website. We will attempt to enhance communication accessibility by using keywording. Caitlin Reinhardt and Susan Harper will be providing this service with our sincere thanks. Please note that questions will be held till after the presenters have spoken, and we will use our Q&A feature at the top of your screen, or the chat function is also available to be used. Following today and in the next few weeks, we will be mailing out to all of you who have registered a link to our Central South Stroke Network website where the recording and eligible slides will be posted. We will also be distributing a resource summary of the various resources and supports that our speakers present to you today. So know that this resource is coming to you. We hope that this resource will serve you well as you continue to navigate your financial journey. We also ask, we'll be posting an evaluation in the chat towards the end of today's session, and we really would actually encourage you to complete that. It is very valuable for us and our presenters to have that feedback. We'll also send out a link with the evaluation later as well for those of you who aren't able to complete it this afternoon. Also, to begin today, I'd like to share with you a formal land acknowledgement. As we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years, and we recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. This afternoon, I'm pleased to get us started, and I'd like to introduce you to our first speaker, Sarah Skeins. Sarah is a social worker at Grand River Hospital, where she has served for 14 years, with the last of her 4 years working specifically in stroke. Sarah is going to lead us off. Sarah?
Thanks, Eileen. A stroke happens in the blink of an eye. No one plans for it to happen to them, and your whole world is turned upside down in an instant. While you're now receiving treatment, whether it be at acute care or in rehab or attending multiple outpatient appointments, the world outside continues to go on. Bills come in, and the responsibilities just keep building up and continue to knock on the door of your mind. The financial stressors that can come after a stroke are not isolated to only the stroke survivor. It impacts their supported loved ones as well. With that said, I'd like to introduce you to Claire. Claire's husband, Kevin, was admitted to Grand River Hospital last July after a stroke. He was discharged home from rehab on August 30th to his home in Clifford, a small town in southwestern Ontario, with Claire serving as his care partner. Kevin had follow-up therapy arranged through the Community Stroke Pathway and PSW supports through Ontario Health at Home. Once home, Claire took on the caregiving responsibilities while also working full-time. The immense stress placed on Claire to continue to provide for her family was impacted by many factors, including the cost of transportation, limited PSW supports, and the costs associated with attending day programs. This stress has continued to build into insecurities related to food and to housing. Here's Claire's story.
Well, thank you, Claire, for your time and your willingness to share your story. As you think about your experiences since Kevin was discharged home and the impact on your financial situation, can you tell us about the financial stress as it relates to his ongoing recovery, including the costs of transportation, personal care, and therapy?
Basically, we've only been able to do the bare minimum for him when it comes to anything that we're not receiving help with, due to the fact that I am the only one working at this point. Any of the appointments that we have for him, and they are numerous, I have to book time off work. I'm a factory worker, so if I'm not there, I don't get paid. I have a lot of, I've been where I work for numerous years, so I do have a lot of holidays. However, if I'm not there to bank the hours with my employer, I don't have the holiday money, so to speak, to get holiday pay. Especially lately with the snowstorms and such where we live. The snow has been brutal. There was a time I would drive it and hope for the best, but now I have to make sure that I am home for Kevin. In the past, I would just work extra time and get home when I get home, but I have to make sure that if I leave the house, I can get home to make sure he's taken care of. Everywhere that you go, hospitals, and that's where we seem to end up mostly, is you have to pay for parking. There's no coverage for that, you know. But the biggest thing is missed time work. There's nothing that you can do to avoid it. You cannot, there's some doctors that will work with you. There's others that just don't care. They give you the appointment and call them back. You'll get a reply 48 hours, maybe later. And it is. So that huge financial loss. And we are basically struggling so bad with meals because of the costs of living going up. I'm trying to budget for all of his meals daily. He eats more now than he used to when he was working. Recovery. So I have to try to make sure that I have breakfast, lunch, and dinner. And because the finances are so low, I will go without myself. And then we've actually had arguments, as silly as it seems, because I'll come home from work at night and he's actually eaten the next day's lunch. And then I'm upset because there isn't anything for him to eat at lunch, and I don't know what to do for the next day. So I'll try to go out depending on what shift I'm on, and I'll try to go out and get him something that can be quickly made, because everything has to be made for whichever PSW comes to just stick in the microwave, because he can't really do it himself. He can't see the numbers, or he can't always remember how to work the microwave. He's getting a little bit better with that, but it's trial and error. Finances have literally gotten so bad. We just put our house up for sale last week, and we're hoping that with the sale of this house, we will be able to be mortgage free to get a house in town. And hopefully we don't have to settle for something, because where we live we've been here. This is our dream home. We're supposed to be here. This was supposed to be our last home, but I can't do all of it anymore.
Thank you. I know this is very hard for you to share, and I know you've been through a lot since Kevin's stroke. Have you had any, being in your rural area, have you had any financial stress related to just Kevin? I know you get the PSW support. Is there any other additional stress related to his personal care or his therapy?
Yes, he needs a haircut. He needs a haircut so bad. I need a haircut. But him, it's everything that I try to do that I will go without. Is it doesn't matter. He needs a haircut. To me, that's like, as much as he needs it, it's a luxury right now. And how sad is that? Like, that's pathetic. I should be able to get him a $25, $30 haircut. But again, I'd rather buy him something that he likes to eat, to, snack on or something. He needs clothes, because he's very challenged. I'm sorry. It's very challenging to dress him. He has very hard time. He was always a t-shirt wearer. He has very hard time getting t-shirts on. He can't dress himself. So he can't wear jeans. So he has sweatpants, but he needs other sweatpants. He can't tie his sweatpants closed. So I need to be able to buy stuff like this, and I can't. I just don't have the money. And I'm not buying clothes for myself because I have work uniforms. So that's all I need right now. But he's not getting that stuff, and he should have extra clothes, or clothes that are right for his needs for right now. So that stuff's not addressed either.
Yeah, we can appreciate you're doing everything you possibly can. And I know you're working 2 jobs right now to try to make ends meet. So definitely, I'm hoping that the session today is going to help with, providing some resources to help with the financial stress. Just one last question. Are there any positives that you can share, or any lessons that you've learned along your journey that might help somebody else going through a time of financial stress?
The hardest thing I had to do was ask for help. We've always been self-sufficient. We've always been workers. I mean, I've held down 3 jobs at a time just because, just not out of necessity. When my husband was working, he made good money, and we were doing okay. Um, so we were always on the farm ourselves, and we didn't need to do much. We didn't need to go out. So I've done so much on my own, but when it took me a bit to reach out for the help, and when I did, I was extremely grateful for everything that we got. And that's the biggest thing that you have to do, swallow a little bit of pride. It's hard. It's really hard, but you need to ask for help. And it's even better if it's there to get,
Absolutely. Well, I just want to say thank you to you and to Kevin for sharing your story today. I know it's been difficult for you.
You're
So
very
thank you.
welcome. I'm happy to be able to share it, as much as it's not an easy story. I'm happy to be able to show what some people go through. So thank you very much.
Well, thank you, Sarah, and thank you, Claire, for sharing your story. I'd like to introduce our first panelist speaker. We have Amanda Ramkishan from March of Dimes Canada. Amanda is an accessibility and disability professional who's passionate about working with people with disabilities and those impacted by stroke. She joined March of Dimes in January of 2022, and she facilitates the national online peer support groups, which are open to persons with stroke and care partners across Canada. She sees firsthand just how much peer support makes a positive difference, and in people's lives, how it can impact and lessen the load. Amanda also brings lived experience as a care partner to her father, who is a person with stroke. I'm pleased to introduce you to Amanda.
Thank you so much, Eileen. And hi, everyone. It's an honor to be with you all here today. And I'm so excited and happy to be talking about the March of Dimes Canada After Stroke program. March of Dimes Canada is a national disability support organization that has been around for over 75 years. We work to create communities in which people living with disabilities can thrive. And our vision is to have an inclusive, barrier-free society for people with disabilities. Today, we will be talking about our After Stroke program, which is about bringing health, hope, and humanity to stroke survivors and their families. We aim to ensure a supported transition from hospital to home and beyond. Our After Stroke program focuses on improving overall well-being for stroke survivors and their families, and helping people regain their independence and quality of life. Next, we use an outcomes framework to help design the delivery of our services and ensures we are meeting the needs of the communities that we serve across 6 key domains of wellness. We want everyone to be healthy, connected, engaged, safe, empowered, and equipped to well-coordinated services and supports to meet your needs. Next. Our services are available to stroke survivors, caregivers, and their families. We are committed to supporting you at any age or stage of your journey. We do our best to meet each individual where they are at and to provide support as long as you need. You can be referred to our After Stroke program through our healthcare provider. You can self-register yourself or through community-based agency and services. You can reach out to us at any time. Support is available by phone or online. Next. We have a group of skilled, caring staff that are here to help. Once someone calls our after-stroke support line, our information navigator provides real-time support about all of our programs to help get you connected and can answer any questions you may have. Our intake coordinator and information navigator are there to help you make that initial connection with us, and we'll do a brief call to determine your readiness for the program. From there, they connect you to an after-stroke coordinator who is a dedicated staff member with a focus on case management and community reintegration. They can work with you one-on-one to develop a personalized plan and to help you reach your goals. And they can connect you with any resources or services you may need. And together they will work with you to develop an action plan. Next. When you meet one stroke survivor, you really only meet that one unique stroke survivor, as everyone has a unique journey. Our after-stroke coordinators offer personalized support one-on-one to stroke survivors and their families, and to help you reach your goals. We have specialized speech and communication programs for stroke survivors with aphasia to practice and improve their speech in a safe and welcoming environment. Next. We also offer many education and skill development programs. One being, we offer our monthly education series called Ask an Expert. Ask an Expert is where we have subject matter experts and incredible speakers that talk on a variety of topics like stroke prevention, intimacy, spasticity, medication management, caregiving, and so much more. All sessions are recorded and available on YouTube. Ask an Expert is open to our stakeholders, community partners, clients, and their families, and there's no cost to attend. There is a registration that is initially required, and the topics covered change each month. We also offer Living Life to the Full. This is a mental health program that was developed by the Canadian Mental Health Association, and it's run by our March of Dimes staff, and it's offered as a series of 8 90-minute online group-based sessions, and it teaches participants really how to recognize and work through their feelings and emotions. There is a $50 fee to participate, but of course the cost can be waived if necessary. And there is an eligibility screening just to ensure that clients are a good fit and ready to commit to the program. Next. We also offer virtual exercise programs, which is a 10-week online group-based program, and it's designed for people with varying ranges of mobility. It consists of 3 levels of programming, and all classes are aimed to improve participants' balance and body awareness and prepare them for community-based wellness and fitness activities. We also offer GRASP, and GRASP is an acronym that stands for Graded Repetitive Arm Supplementary Program. It's a 10-week online program designed to improve the function of upper arm extremity of the arm and hand. It's not meant to replace existing therapy, but more to add practice time at home. Participants carry out exercises independently or with a family member. And we have trained instructors and volunteers who are delivering the program, and there is a $50 fee for participation. Next. Aphasia Peer Connect is a weekly 1-hour online social group for people with aphasia and communication disabilities to practice their speech in a safe and supportive environment. Our staff and volunteers provide a welcoming, safe space to work towards increased confidence and communication skills. Next. Peer support is really instrumental and is a large part of what we do because it really shows people that they are not alone and that there are others going through a similar journey. We offer several different in-person and online peer support groups that are offered to stroke survivors and their caregivers across Canada. These groups provide an opportunity to create connections, get support, and build friendships. All of these peer support groups are listed on our website with the date and time details. We also offer Hospital Peer Connect, where we have trained volunteers that go into the hospitals to provide peer support, either in the rehab unit or stroke unit. The aim of this program is to really help make a connection early on between an individual who's newly diagnosed with stroke to chat with someone who's well on their way into their journey and can share their own lived experience and offer educational resources. Next. And we know that as much as it is the stroke survivor going through their journey, it's also their families and the people in their lives that are also going through the journey with them too. We offer 2 online peer support groups for caregivers of stroke survivors, as well as a group specific for life partners or spouses of stroke survivors. We also offer a self-directed caregiver support e-learning modules that are self-paced videos that can be watched anytime. Next. We also offer technology support programs at March of Dimes Canada that can be accessed for anyone with a disability and is designed to empower people to build their digital skills. Many of our clients need a little bit of a refresher or need a little bit of one-to-one help to make sure they're confident in terms of using technology. So whether you're new to technology or you're looking for a device recommendation or have a quick question, we do offer guidance and support and do offer drop-in online sessions. We also offer Skilling Up, which is a comprehensive free digital skills training program. And Skilling Up gives people with disability the skills and confidence to be successful in jobs that require digital skills. Next. Next. March of Dimes Canada has a number of specialized programs supporting people with disabilities across the organization. Some programs are province or region specific, while others are available across Canada. These include funding for vehicle and home modifications. We offer programs that are specific for individuals with brain injuries. We offer supportive housing and assisted living. We also offer a really robust advocacy program that teaches clients how to be their best advocate. We also offer employment services, and I encourage you to visit the March of Dimes Canada website and have a look there for more information. You can subscribe to our monthly newsletter called Snippets, and this gets sent right to your inbox to keep up to date with our programs and services. Subscription is easy. You can just go to our After Stroke website and scroll down to the bottom, and there's a Stay in the Know section that you can fill in with your email. Next. How to contact us. You can also call us on our After Stroke support line, which is 1-888-540-6666. Monday through Friday between 9 a.m. to 4 p.m. Eastern Time to answer any questions. You can also visit our website, www.afterstroke.ca. Our website has a wealth of information. There you can find a link to our referral form if there's any healthcare providers or allied health team professionals to refer your patients or individuals that you're working with. And you can also email us at afterstroke@marchofdimes.ca. And this email gets monitored daily, so you can usually get a fairly quick response to your questions. And thank you all so much for listening. You have all been an amazing audience. I really appreciate your time, and I'm looking forward for a great day together. Thank you.
Thank you, Amanda. I'm pleased now to introduce our next two speakers from Vision Loss Rehabilitation Canada. Amanda Frimmer is the Manager for Healthcare Operations for Central West Ontario. She's been with the organization since 2023 and has 10 years of previous experience in healthcare, social services, and retail. And Sue Marsh-Woods is the Manager for Health Operations in Toronto. She spent her early career as an orientation and mobility specialist, and she has worked as a manager for the last 31 years. I'm turning it over to you, Amanda and Sue.
Thank you, Eileen, and thank you everybody for welcoming us today. As mentioned, I'm Amanda and I'm here with Sue. We're going to talk to you a bit about Vision Loss Rehabilitation Canada, what we do, how we can help, and some resources to help with financial stress after stroke. Next slide, please. So who we are, Vision Loss Rehab is a not-for-profit national healthcare organization, and we are the leading provider of rehabilitation therapy and healthcare services for individuals with vision loss. We work in the community, in clinics, in your home, or in medical centers. We can go anywhere, and you get to decide where your rehab comes. We see people of all ages, and our services are covered by provincial healthcare. So we do serve around 1.2 million Canadians who are living with vision loss and blindness, and this was as of 2019. This is vision loss that impacts their quality of life, and there are more than 8 million Canadians living with eye diseases from one of the 4 major conditions, which is age-related macular degeneration, glaucoma, cataracts, and diabetic retinopathy. So what do we know? How do we understand vision loss? As mentioned before, there are the age-related conditions. There's disease or medical conditions such as diabetes or stroke, or there's due to an accident or trauma. Here on the slide is a list of the breakdown of our services. So the first part of our services, when you get a referral to us, is our client navigation department. They coordinate and integrate post-vision loss rehabilitation. It can start through the referrals on our website, or it can start with a phone call to our intake department. Sue, do you want us to keep going from here?
Yeah, if that's okay, because I can talk about the rapid response. So it's great to be here. Yeah, so as Amanda said, everything starts with client navigation. So related to stroke vision loss, we do consider stroke-related vision loss to be a high priority client, simply because 100% of them have either just come out of hospital or they're just in the middle of finishing rehab, and we don't want to waste time. We want to get in to see them. So the client navigator would sort of make that initial call to the referral source, whether it be an OT, a social worker. And the goal of that call is to just try to tease out what are the main areas of concern, because as we know, stroke outcome can look different for everybody. And certainly we've seen a significant increase in stroke-related clients coming to us. It's unheard of what we're seeing now. We know that vision loss represents, I believe it's something around 60% of people that have a stroke have some degree of vision loss. And so We're often invited in by occupational therapists and other professionals. We've done a lot of outreach. So the first service that we would be considering, and probably the best place to begin, is our primary service, which would be a practitioner, a low vision therapist who would do what's called a functional needs assessment. So typically looking at how do we compensate or help the individual compensate for those vision loss, like hemianopsias, where you've got left field neglect. Oftentimes, I would say that our approach is collaborative. It has to be. We can't work in isolation, so we work very closely with OTs, PTs, SLPs, social work, to kind of figure out what's the best approach. And I think the one benefit of VLRC is we do work in the client's home. So oftentimes we will be kind of carrying on the rehab that gets started, either through inpatient or outpatient rehab. So we have a very, very strong connection with all of the rehab hospitals here in Toronto, as well as the acute care hospitals that have stroke units. So our specialized service would be focused more on sort of a longer term issues that may be coming up. So the two services, or three rather, that we would be offering is independent living skills or vision rehab therapy. And that looks at all of the ADL skills. How are they managing in the home? How are they using their technology? It's a whole plethora of areas. Our orientation and mobility specialists are probably more involved with our stroke patients because mobility can be compromised when there's a visual field loss. They're bumping into things. They don't feel as safe. Traveling in crowds can be difficult. And the third service is our assistive technology, which provides funding for high-tech equipment. There is criteria, of course, but certainly it's an area that we're extremely busy. So we would start always with that primary service where we do that functional assessment and figure out what's going on. And again, going into the hospital, observing the therapy, it's the only way that we can actually provide service. So the next two programs on the slide, the concentrated programs, these are designed to fill gaps in care and reduce the overall burden on healthcare. So we do have two areas that I would say we've kind of fleshed out, probably three: falls prevention being one, a stroke program, and looking at aging in place. So I won't get into a whole lot on that because they're still evolving across the country. But what is important is the emergency response. And this is really what we refer to as our rapid discharge. So people that are in hospitals, whether it be acute or rehab, these are the people that we want to make sure are contacted within 48 hours so that we can figure out what type of a care plan can we put in place, whether it's going to be an intensive 4-week collaboration with OTs, PTs. But we're finding that now that the hospitals are aware of what we do, it's really made a significant difference in how we're responding. So we can respond quickly. Sometimes people aren't quite ready to begin therapy with us, and that's fine. We can just give them the time they need. And when they're ready, they would get back in touch with us. So I think that's all for services. So just kind of gives you an idea that these are core services that we offer, but when it comes to somebody with stroke or brain injury, they're considered high priority. All right, over to you, Amanda.
Absolutely. So in terms of financial resources after stroke, we do offer rehab from certified specialists. Our rehab is already funded. This means that it does not cost you for vision rehab from VLRC. We have worked incredibly hard to minimize barriers. Our specialists come to you, your homes, your hospitals, long-term care, community locations, or office spaces. You and your loved ones can determine the best space for your rehab. In addition, we collaborate with workplaces, schools, facilities, and professionals like Sue mentioned on assessments to enhance your environment after vision loss with a focus on functionability and safety. We know what resources are available and our team helps you navigate them. Our specialists are ADP, which is the Assistive Devices Program authorizers. And VLRC is also partnered with NIHB, which is the Non-Insured Health Benefits, and VAC, which is Veterans Affairs Canada. Next slide. So what is ADP? ADP is the Assistive Devices Program. It helps determine what, our specialists help you determine what devices you could be eligible for. Eligibility is assessed by a certified specialist, and we also assist with the paperwork process because we do understand that that can be an onerous part of your journey. Up to 75% of appropriate devices can be covered, and some examples include magnifiers and daisy players. Next slide. In terms of referrals, one of the great things that I think is about VLRC is that anybody can refer. So a healthcare professional can absolutely refer, occupational therapists, social workers, doctors, but family members and individuals themselves can also do their own referrals. Referrals can be found on the website or by fax. We do also have a toll-free number on another slide in which if you need help with the referral process, you can call. So our toll-free number on the next slide is 1-844-887-8572. You can also email info@vlrehab.ca, or you can attend our website, which is visionlossrehab.ca. And on the website, there is a tab for referrals. Next slide. If you have further questions, we do have a question and answer period coming up after this round of speakers, but myself and Sue have our contact information on here as well. Our emails are there if you'd like to reach out. We know that sometimes these presentations can be overwhelming and it might come to you later on. So our inboxes are open to assist you if needs arise in the future. But thank you all so much for having us today. We really appreciate being a part of your series.
Thank you, Amanda and Sue. We appreciate having you here as well. Our next presenters are Katie Harder and Ashton Ahmad. Katie is our ADP authorizer. She's an OT, in the hospital setting, and she has 18 years of experience. She's currently the professional practice leader for OT at Grand River Hospital, which includes providing occupational therapy practice guidance across the stroke continuum. She has also been an authorizer in the mobility mobility class with ADP since 2010. And Ashton is a barrier-free design counselor working with March of Dime in both Manitoba's Safe and Healthy Home for Seniors program and Ontario's Home and Vehicle Modification program. He has been working with March of Dimes for the last 1.5 years. So we'll start with Katie and then turn it over to Ashton. So welcome to both of you. Katie?
Thank you, Eileen, for that introduction, and thank you for inviting me to join this roundtable discussion today. Next. So the previous presenter did speak about the Assistive Devices Program briefly. I'm going to go into a little bit more detail here about the Assistive Devices Program. So please note that I am not a representative of the Assistive Devices Program, but I am an authorizer with the program. The Assistive Devices Program is funded by the Ministry of Health and Long-Term Care in Ontario, and it helps people with long-term physical disabilities pay for needed specialized equipment. And as you can see from the previous presentation, there are multiple types of equipment that are covered by the Assistive Devices Program. And I will be speaking about mobility equipment that is funded by ADP. So who qualifies for ADP? You must be an Ontario resident with a valid Ontario health card, have a disability requiring the mobility equipment or supplies for 6 months or longer. You cannot already be receiving funding through the WSIB, Workers' Safety Insurance Board, or Veterans Affairs Group A. And also, income is not a factor in determining if you are eligible for the funding. Next. Like the visual aids that were discussed previously, up to 75% of the cost of the device can be funded by ADP, and the remaining 25% is covered by the individual. However, if the individual is receiving Ontario Disability Support Program funding or Ontario Works funding, the remaining 25% of the cost is also covered, and it would come out of those agencies. Thank you. So what types of mobility devices are covered through the ADP Mobility Class program? Many devices. Manual wheelchairs. So wheelchairs you have to propel yourself. Tilt wheelchairs that need to be propelled. Power wheelchairs and power scooters. Power add-on devices. So these are devices that you add to a manual wheelchair to give some power for the wheels. Positioning devices are covered. So things like wheelchair cushions, backrests for the wheelchair, head supports for the wheelchair, and in the case of power wheelchairs, power tilt and recline can also be covered. Forearm crutches are covered. Wheeled walkers, so walkers of varying styles are covered. And also there are pediatric walker standards and strollers covered as well. Next. I've just included some photos of commonly prescribed devices after stroke. So we have, just so you have an idea of the lingo associated with the device. So on the far left, we have a two-wheeled walker, and those are walkers that fold up quite small. Often they're used with people who are walking, but slowly. We have rollator walkers, and those are walkers that have brakes and a seat, and typically they're used by people who are walking a bit faster. Then we have manual wheelchairs. You can see there that the manual wheelchair does not tilt, so it's the blue one there. It has a cushion on it, and you can see how the backrest does not have supports on the side to support somebody's trunk. So that type of wheelchair, you could pull the cushion out and then fold the wheelchair up and put it into a car. So I guess I'll say it's important to speak with whoever is helping you obtain this device, and kind of know for your lifestyle, what are you needing? And sometimes it's a balance deciding what device to pick. There are also manual tilt wheelchairs. So you can see here that the wheelchair actually tilts back. And the reason for that is to help, it's often to keep somebody's trunk and head and neck in midline position. These types of wheelchairs often have backrests that have what we call lateral support, but they have support on the patient's trunk or the client's trunk to help keep it in midline. And the tilt feature is very helpful in preventing pressure ulcers as well, because you can shift where the weight is based on the angle of tilt. And then we also have power wheelchairs. And there are also power wheelchairs that have power tilt and recline, and I'm not going to get into those. Those are, if someone needs a power wheelchair with power tilt and recline, those need to be accessed through the centralized equipment pool, which is beyond the scope of this presentation. But of course, an occupational therapist could assist with navigating that. Next. So what about mobility device replacement? So let's say you've accessed ADP before for a rollator walker, but now you require a wheelchair. Well, ADP has stipulations that if somebody's medical condition or functional ability has changed and the current mobility aid is no longer meeting somebody's needs, that you can apply again to ADP, and often funding is received for a new device if the conditions of the program are met, meaning that the functional ability or medical condition of the person has changed. Replacement of a mobility device receiving funding for this can also be obtained if somebody's body size has changed and the current mobility device no longer fits, or if the mobility aid is worn out and cannot be repaired at a reasonable cost. Typically, in my experience, this is at the 2-year mark for backrests, headrests, cushions, and at the 5-year mark for the actual frame of the wheelchair. However, this is not kind of written in stone, but that seems to be the general guideline. Important to note is that lost devices or devices that are damaged through misuse or neglect are not covered for replacement. Next. So how do you obtain this funding? How do you obtain a mobility device funded through the Assistive Devices Program? You need to obtain an OT, occupational therapist, or physiotherapist assessment to determine which type and style of mobility device is right for you. And I have a slide at the end of this presentation that details how you can find an OT or PT to assist. The OT or PT who is prescribing the device must be registered with ADP. It's important to note that not all OTs and PTs are registered with ADP. To obtain the funding, the ADP application form must be completed, and you must use a business that is registered with ADP. So the OT or PT can help you find vendors that are registered with ADP to sell products that are covered by the ADP program. At a minimum, the OT or PT walking you through this process that have completed the mobility assessment must give you a minimum of 3 vendor options that you can choose from. It's important to note that ADP, the government program, sets the price at which a vendor can sell the device. And so the prices should, if it's funded by ADP, should not be changing based on the vendor. The application form and a list of vendors in Ontario registered with ADP can be found at the link I've provided there. And all of this information is from the Assistive Devices Program, and so that can easily be searched. If you search Assistive Devices Program, mobility aids, all of this is directly from that website. Next. So what happens next? So you've found an OT or a PT, so they're going to complete the assessment, help you figure out what device is most appropriate, because within the category of walkers and wheelchairs, there are many, many, many choices. And so they can help you navigate that and determine what's best for you. And then they should be the ones telling the vendor what you need, not the other way around. They help you, the OT and or PT should help you complete and submit the ADP funding application form. It's a 12-page form. Not all pages need to be completed, but you really must have an OT or PT help you complete that. The vendor will provide the device at the assessment session or order in the appropriate device. The OT or PT authorizer need to assess you with the device to ensure that it's the right device for you and that it has been set up and adjusted correctly. The authorizer should also be notifying you when the funding has been approved by ADP and give you alternative options in the event that funding is denied. Next. So how do you find an authorizer with ADP? There are a couple of options that I can provide you here. You can email the ADP program at the email on this slide. You can contact the Ontario Health at Home program, which is the provincial agency that provides home care services. It used to be called CCAC. It has been called the LIN, and so now it is called Ontario Health at Home. There is a phone number I've taken from their website there that you can call, and you can request a mobility assessment and ADP application when you call. You can also use the link I've provided there, and it will link you can link to your specific branch office. Anecdotally, I understand that the wait time for service in our area is around 4 to 8 weeks to obtain an OT or PT assessment for mobility device, but that's just anecdotally, and that's not coming from Ontario Health at Home. But I'm just trying to let you know that it might take a little while to get the assessment. And the OT or PT will walk you through the process as needed. The third option is to pay privately. So if you pay an OT or PT privately to do the assessment, typically it's around $100 to do the walker assessment and can be up to $375 if you're going for a power chair. Again, that's just a range when I was calling around as to what the typical rates are, but you would have to obviously establish that with the OT or PT you're working with. And typically it's a flat rate depending on the device and vendor you choose. And typically people can get service within 1 to 2 weeks. Next. Yeah, and that is the end of my portion of the presentation, and I'll be sticking around for questions afterwards.
Awesome. Okay, my name's Ashton, and I'm a barrier-free design counselor with March of Dimes Canada. So I'll be going over the home and vehicle modification program, sort of what we fund. And you'll notice that we fund things that aren't funded typically by ADP. The things that we can't fund, you could approach ADP for typically, or other funding devices or funding agencies. Next slide. So a little bit about our home and vehicle modification program. It was founded in 1999. It's seen many changes. It's grown over the years. And right now it's at the quickest it's ever been in terms of processing times. We have a full staff of intake. We have a full staff of barrier-free design counselors and a management team to review all the applications. We look at each application on a case-by-case basis, and sort of the main goal of the program is to reduce or eliminate physical barriers in the home that are creating life safety risks or impeding people's ability to complete activities of daily living. So we're looking to provide funding for modifications, adaptations, or devices that enable children and adults with mobility restrictions to continue living in their homes, avoid job loss, and participate in their communities. Next slide. So about the program, we have a lifetime maximum for the home portion of the program of $15,000 per individual that's eligible per lifetime. And then the vehicle section of our program is $15,000 maximum per individual every 10 years. So for home modifications, it's one, and for vehicle modifications, it's another funding. But it's processed by the same team, and we have 2 different applications. We actually have 4 applications. We have 3, one for home modifications, one for adaptations and devices, and one for vehicle modifications. So the program does not provide reimbursement, so you would apply before getting your equipment. You would apply to our program for funding approval, and wait to connect with a barrier-free design counselor to discuss your application details and sort of the next steps from there. Next slide. So now we're going to look at eligibility. So in order to be eligible, you need to first be a permanent resident of Ontario. We do have a financial threshold, so we're aiming to provide basic and essential equipment to those who need funding for the equipment. So those who are in the most financial need for the equipment. So a household income would be the applicant's income, and if the applicant has a spouse, then it would be the applicant and their spouse's income that we consider for household income. That income needs to be below $60,000 to be eligible for funding. If your income is below $35,000, then you would not have a required contribution amount and you would be eligible for 100% funding. Depending on your income, between the $35,000 threshold and the $60,000 threshold, there is a required contribution range that would be discussed on a case-by-case basis and evaluated on a case-by-case need. Things like a disability tax credit, for example, could reduce a family's required contribution. And we look at other things that we can on a case-by-case basis to reduce any contribution. But all of that would be discussed at time of application. And the last eligibility criteria marker would be that you need to have a permanent, ongoing, or recurring disability that impedes mobility and results in substantial restrictions in your activities of daily living. So your eating, your bathing, your toileting, transferring, your mobility, and or getting in and out of your home to access essential medical care or community services. So we don't fund for mobility devices. We don't fund for positioning devices. You would approach ADP for that. But other devices that could help eliminate physical barriers in the home, we would fund. So for construction projects, so these are typically your most costly projects that you're undergoing. We have a little bit of extra eligibility criteria. You need to own the home in order to receive funding for a construction project. Or if you're living in a home that's owned by family, then your family member could apply to have the funding done on their home with your funding to make it more accessible for your needs. The rationale sort of behind this eligibility criteria is in the past we have seen people who were renting units getting modifications done or construction projects done in their home, and then either rent being raised to a point where the person can no longer afford to live there, or the person is evicted and the value of that unit is now increased for the landlord. So because of those situations that we were seeing, we do have this requirement that the home be owned by either the applicant themselves or a family member. Next slide. So these are things that we would fund under the home modification construction category. So door widening, and if you're an individual using a wheelchair or you're applying on behalf of somebody who uses a wheelchair, you might need door widening. Vertical platform lifts we can fund for. Those are entry and exit devices that help people using wheelchairs or walkers get into their home. If you have a deck and you can't manage the steps, perhaps a vertical platform lift would be something that you would look into. Kitchen adaptations, rearrangement, lowering and raising of kitchen cabinets and cupboards and things like that we would fund for. Bathroom adaptations. So zero threshold showers are what we fund. Previously, if you're familiar with our program, you might have heard that we fund for walk-in showers. We no longer fund for walk-in showers as the ledges in walk-in showers can present physical barriers if people have conditions where they continue to decline as people age. Range of motion can further decline. So with that in mind, we fund for barrier-free showers, so either a zero threshold shower or some companies have what's called a roll-in shower pan. So the threshold or the edge of the shower is angled to allow for a wheeled commode, a wheeled shower commode, a tilted wheeled shower commode, for example, as well, to access that shower in a barrier-free way. So if the bathroom structure cannot accommodate a zero threshold shower or a roll-in shower, or for in some situations you own the condo, but your condo board will not approve the construction project, you can get what's called a portable roll-in shower, and we do fund for those as well. So that is something to keep in mind. Next slide. So the limitations of construction to keep in mind. So construction projects are typically costly. Again, the funding maximum is $15,000. So if the cost goes beyond $15,000, you would need to either yourself contribute the difference, or find another funding agency that's operating that could help subsidize the remaining costs. You might approach 211 if you've heard of that. It's a hotline that's available province-wide. So there's been lots of great resources that we've heard today, but if there's still gaps in sort of resources that you're looking for, you might want to approach 211. You can either call that number just as you would 411 or 911, or you can go online and Google 211 and find your provincial's website, your province's website, that is. So again, so construction is considered a last resort. So you need to have your occupational therapist sort of examine and explore with you what more basic and essential devices might be suitable, might be better suited for you before applying for a construction project. And when your occupational therapist, which we'll get into in upcoming slides, when they're doing their assessment, they're going to be providing a rationale for the equipment based on their assessment, based on the individual's needs. So they would just sort of explain whether or not more basic and essential equipment has been explored, why this particular construction project is the most basic and essential project that should be funded. And so those are things to keep in mind when you're completing your application. Next slide. These are eligible devices or adaptations that you would complete using the adaptations and devices application form. So typically we see grab bars, we see floor patient lifts, Hoyer lifts, Sarah studies. We fund for environmental controls, automatic door openers, modular ramps, stair lifts, ceiling track lifts, and tub cutouts. So any of the items that are eligible on this list that you see with an asterisk next to it, just keep in mind that you might need to provide additional documentation. So if you're in a renting situation, you are eligible to apply for any of the eligible devices or adaptations in this list. But you might need landlord approval for, say, a modular ramp or a stair lift, for example. That would be a semi-permanent installation into the home. And then pre-photos of your space, things like that, measurements. If you're getting a stair lift, you're going to need measurements and pre-photos of the stairs and sort of the plan that your vendor has gone through with you and your occupational therapist about what the plan is for those pieces of equipment. Next slide. So vehicle applications, and just a reminder, towards the end of this slide presentation, we'll have our contact information. It's a lot of information about our program all at once, but we have a fully staffed team ready every day, Monday to Friday, during business hours to go over your application questions and to help guide you in addition to your occupational therapists. So just keep that in mind as we go through all this information. So vehicle applications, you would need to own the vehicle and have a valid driver's license, or have the vehicle being owned by a family member who is a primary caregiver that would be providing transportation for the individual who is applying. So we can fund for things like transferable equipment, hand controls, foot controls for individuals who are driving themselves, or for people who are looking to get vehicle modifications or adaptations to a vehicle that is their primary mode of transportation, but somebody else is driving. We can fund for lifts and ramps and things like that for vehicle modifications. The raising or lowering of a vehicle roof or floor, barrier-free modifications to your carports, automatic garage door openers, things like that. Um, all of the lists that you've seen are almost exhaustive, but not quite. We always do look at every application on a case-by-case basis, having a conversation with the applicant, having a conversation with their occupational therapist. So if there's anything that you haven't seen today that you're wondering about, on the next slide, we'll explore things that aren't eligible, but feel free to give us a call or an email, and we'll definitely go over any questions that you have. So things that we can't fund are concrete ramps, keeping in mind we do fund for modular ramps that are transferable pieces of equipment, or in some situations we can fund for a wooden ramp if, for example, in sort of the more northern parts of Ontario, if you're on the Canadian Shield or your properties on level, and a modular ramp would not be suitable because of the properties, like the physical ground of your property. We could look to fund like a wooden ramp in those situations. We don't fund for concrete ramps due to cracking and weather concerns that can happen with Canada's extreme hot summers and extreme cold winters. Um, we don't fund for the purchase of a vehicle itself, but we do fund for adaptations to vehicles. So if you're applying for a vehicle modification, we could only fund towards the actual accessible modifications, but not the purchase of a vehicle or a home. Anything that's therapeutic um, or therapy related, unfortunately, is not eligible through our program. We're looking for the most basic and essential solutions to eliminate physical barriers in the home, in entering and exiting the home, transferring and mobility within the home. We don't fund for walk-in showers or walk-in tubs. We can't fund for hospital beds. Suction grab bars we can't fund for. We would fund for grab bars that get installed to the actual wall, or the tub grab bars we could fund for as well, but just not suction because they're not as safe. Um, and again, this is a list of ineligible requests, but this might not be exhaustive, this list. So again, we do look at every application and discuss it on a case-by-case basis. Next slide. So briefly, we'll look at the required documents. So these are the main pieces you're going to need to submit for a successful application. You're going to need a signed application. So on page 7 of our application, it has our consent form. You put your signature or your representative's signature if you're applying on behalf of an individual or a family member. The representative would sign there and date it, and it's a consent saying that the individual is aware that they're applying for this funding, and things like that. So you would also submit your proof of income. This can be a notice of assessment. If you're above that $35,000 threshold, you might submit a T1 general. That would have information like a disability tax credit, medical expenses that you had in the previous tax year, things like that we can use to reduce your required contribution amount, and possibly eliminate any required contribution. You're going to need an occupational therapist letter of assessment, or they can fill out our verification of disability form that can be found on our website. All of our application forms and disability verification of disability forms can be found on our website. And I believe we're also sending that out to all the participants of this roundtable. And then the last piece of information you're going to need is your price quotes from your vendors. And then we would, if you have multiple on the file, we would have a conversation about who your preferred vendor is. For certain applications, if it's a construction application, if it's for a curved stair lift, you would need 2 or more price quotes to be submitted. But if you're applying for, say, a grab bar, you would only need one quote. And then again, you might need additional documentation just depending on the scope of your application. Next slide. So this is just an insight onto our application time. So as I mentioned at the beginning of my section of the presentation, our application times have never been faster. We're receiving applications and sending out a confirmation that the application's been received and uploaded into our system within 5 days of your submission, and then 5 business days, that is. And then within 15 to 20 business days, your application will have been reviewed by an intake counselor. The barrier-free design counselor will have reached out to you to discuss the application, proceed, and an outcome will be determined within 15 to 20 business days of your submission. And the next slide is our contact information. So again, that was a lot of information about our program. But if you have any questions about how to apply, are you eligible, anything like that, we're here to answer any questions that you have. So you can give us a call and speak with one of our intake counselors or our barrier-free design counselors, or you can shoot us an email at hvmp@marchofdimes.ca, and we'll be answering any of your questions that way as well. And so I believe now we'll have a question and answer period for all the presenters we've seen today.
Thank you, Ashton. And yes, you're right. We'll now move into our Q&A section of our panel presentation. So I welcome all of our panelists to come back on camera. So we have the two Amandas and Sue and Katie and Ashton. So thank you very much. What wonderful presentations. And I thought we'll now open it up to our participants for their questions. We would encourage you to use the Q&A or the chat. And just to get us started, I don't know if you've seen the 2 comments already in the chat, but I'm going to read them to you. And I think, Katie, these were more that followed after your presentation. But just to get our dialogue moving, Tim had written, the last time we applied for a wheelchair, the OT told us they only had one choice, that we could not use our preferred ADP qualified vendor. I'm glad to know that we must have 3 potential vendors. So is there a comment there, Katie, that you'd like to share?
Yeah, I would just encourage you to tell the prescribing or the OT or PT doing that assessment that it's a requirement of our college actually to give 3 vendor choices. So sometimes in long-term care facilities, they'll have what they call a preferred vendor, like a vendor that services the home pretty frequently. And while it might be faster service because that vendor is in the building more frequently, you still have the right to be able to choose whichever vendor you want to. And so, because there are many, many, many vendors registered with the assistive devices program. So, but you are the client and you ultimately get to choose the vendor. So I would push back on that.
Thank you, Katie.
And then the other question was around paperwork. It behooves the therapist to lay out everything prior to you consenting to move along with the process. So that is disappointing to hear that the charge was not an upfront thing discussed before the therapy process began with the assessment. So yes, and so home care, if the Ontario Health at Home was the option you went, that is funded through Ministry of Health and Long-Term Care. And so yes, those services you would not receive a charge with those, but the private pay you would have to pay.
Thanks, Katie. Yes, that was the comment from Diane, who had a PT charge them to fill out the paperwork. So, but then she found an OT who was willing to do it for free. So thank you for that.
Yeah, you're welcome. And I would say too that if you're in long-term care, because there are therapists there, that is typically a service that is provided within the home and should be funded. So if you're getting ADP for mobility done in long-term care or through Ontario Health at Home, no one should be charging you. It would only be if you're pursuing private pay independently.
Great, thank you. And now as I look at the Q&A, there's a few things that have popped up there from Nathan. He says, I see that ODSP OW covers costs, but never saw any reference for CPPD. Can anybody speak to that?
I'm going to look at the application form right now and pull it up, but I don't believe that that will get you that last 25%. It has to be OW. If you're a veteran, if you're on ODSP, that will get that last 25% covered. I don't think CPPD does, but I'm going to double check right now.
Thanks, Katie. Let us know. We'll go on to the next comment and then we'll circle back. Next question from Moss McDonald. Sorry, I don't see the first name. But with the After Stroke program, can you explain the group you described as focusing on mental health? I think it was in conjunction with another agency.
Yes, absolutely. Thank you for the question. And for sure, our Living Life to the Full program is offered through our After Stroke program at March of Dimes Canada. And the goal of the program is to really help individuals with managing their emotions and expressing their feelings, and is designed to sort of help with their mental health. And the program is online and it's delivered through a group-based session that's 8 weeks. That's 90 minutes in total. And to register, you can also call our After Stroke support line and reach out to us. And from there, we would be happy to share with you more details and to get you registered.
Thank you. And thank you, Sherry, for your question.
Thank
Going
you.
back to the chat, just playing back and forth here. Stephanie Beadle has said, to my understanding, as an ADP authorizer for both mobility devices, prosthetics, and orthotics, unfortunately, CCPD does not contribute. So not sure what you found there, Katie.
Yes, that's correct.
Two sources have said no, unfortunately, not available through CPPD. There's another, sorry, I'm trying to go back and forth between chat and Q&A. Let me just see. Again, what does the chat have there? As well, Stephanie says ODSP recipients can apply for extension of the medical benefits. However, they must do so prior to turn 65. So another opportunity for those financial supports. Any other questions? Just making sure I'm monitoring. To the Q&A. Don't see any more questions. All of our presenters were so thorough and clear. That's terrific. Thank you all so much. And thank you, Caitlin. She's doing our key wording there.